Hello everyone, welcome to my channel. In this video, we are going to discuss some tips and how to memorize the dosages, strengths, frequency, maximum dosages of various drugs in pharma. If you have taken it before, you know this, and if you have not taken this exam before, you will realize during this process. No matter how many times you revise these, you tend to make mistakes. And these questions are asked in different forms all the time. So let us memorize at least the most important ones and make no mistakes and lose no marks. The key is to keep revising and revising. So here I want to show you a table which I made and used over and over again to practice. Memorize as much as you can and then fill in the blanks in the table. Believe me, we might be older now, but the best way to memorize figures, numbers, is still by writing those numbers again and again. Fill in the blanks. One time effort in making the table, and you are good to go. So here is a picture of the table which I made. So what I did is I took two sheets of paper and used them both back and forth, to make the tables. So let's say I have made a table of antibiotics and analgesics on one paper back and forth. In case of antibiotics, I listed all the antibiotics which are important, which are generally asked about. Let's say amoxicillin, clovelinate, ampicillin, cephalexin, azithro, clarithrol, clindamycin, and the rest of the other as penicillin. And what I did is I made certain columns and rows and I listed frequency, adult dosage, pedo dosage, strength available in the same table. So what we get in the end is we have a very concise information about a drug. Let's say we want to discuss about amoxicillin or we want some information about amoxicillin. Let's say the question is asking about the frequency, we have it here. The question is asking about the adult dose, we have it here. Whether the dose asked in the question is correct or incorrect, we can know it from here. Similarly, the pedo dose, whether the strength is available in the market or not, it is also available here. So all the information about a drug, let us take example of amoxicillin in one column. Similarly, you do this for all the antibiotics. So this makes it very concise to memorize. So all the information in one page and you can carry it anywhere you want and just give a glance at it and you will memorize, like you have to memorize it. So here, this is the kind of table I was talking about. Similarly, I have done this thing for analgesics as well. So we have listed all the important analgesics which are generally asked about. Let's say acetaminophen, aspirin, celecoxib, difluzinal, etodolac, floxaphenin, fluribrufen, ibuprofen, ketoprofen, ketorolac, naproxen sodium. And here we have made table accordingly the questions which are asked. Let's say daily maximum dosage for pedo and adult patients, maximum adult dosage, daily dosage for pedo and adult, frequency of the tablet taken, of the drug taken, and the strengths available in the market. Similarly, we have in the picture which we have on our left side, we have codeine till tramadol, number 13 to 21 onwards. These are all opioid analgesics, which we have it here. And on the other hand, we have anesthetics, which table, by the way, you will find many a times, many a places. But why I have written it here is that when you look at it, you will memorize. So it is just to revise this again and again. So you can make a table of this sort. You can just copy it out or you can download it. You can just pause it and make a table on a sheet of paper, which I would say yes, you should do that, and make a table like this and fill in the information. Let's see how we are doing. So here it is, the fill table. Okay, so we have filled all the information. Let's say frequency, amoxicillin thrice a day, we have done it. What is the dosage of amoxicillin? 250 to 500, pedo 7 to 13 mg per kg. and all the strengths available, we have written it here. So all the information about the drugs which we need and which this table is asking you from, we have filled this table with that information. And let's just talk about the fourth drug, cephalexin. Cephalexin, uh, we do not give it in the pedo patient, so we have crossed it. So while looking at this table, memorizing again and again, looking at this table again and again, we can come to know that cephalexin, yes, this is not given in pedo patient. Similarly, doxycycline is not given, metronidazole is not given, tetracycline is not given. So you have to pay attention to the exceptions here. That is very important. You have to memorize, let's say, make groups of antibiotics which have the frequency, let's say TID, thrice a day. Okay, which of the following antibiotics are used thrice a day? It is amoxicillin, amoxicillin clavulanate, ampicillin. These are given thrice a day, and even metronidazole is given thrice a day. And similarly, memorize from this table which antibiotics are given twice a day, which antibiotic is given once a day. Is there any antibiotic which is given 4 times a day? That is penicillin. So you have to memorize this thing. Now look out for the patterns. Patterns as in, let's say 250 to 500 mg is reoccurring many a times when we are learning about the antibiotics. So have a look at which all drugs have the adult dose 250 to 500. Memorize them as a group. Let's say amoxicillin, it is 250 to 500 mg. Same as ampicillin, cephalexin, azithro. Now what you should do here is look out for exceptions. Exception is, let's say clindamycin, it is 150 to 300. So if a question is asking you about 250 clindamycin, you will outrightly say no, this is not the correct answer because it is 150 to 300. So pay more attention to these as well, these exceptions as well. Similarly, memorize the pedo doses as well. Let's say amoxicillin and amoxicillin clavulanate are both 7 to 13 mg per kg. Ampicillin is 25 to 50 and cephalexin we do not give it. And azithro has a specific pattern, that is 10 mg per kg will give initial dose and then we will give 5 mg per kg. And remember the strengths which are available in the market. Look out for the exception, as penicillin only 300 mg is available in the market. Okay, and let's say azithromycin 250 mg as a tablet is available in the market. So memorize this table, write this table, fill in the information in this table. If you keep on practicing this table, just make this table, and if you're going to fill out the information in this table again and again, it will be really helpful in memorizing all these things. Similarly, look at the analgesics. Let's say, look at the frequency. Let's say, you know what, like when we were doing mathematics in our schools, we used to ask the tables, we used to learn the tables. And so similarly, kind of that thing that you have to cram these things up, but you should know, let's say, ask question to yourself like, okay, which drug has the frequency 4 to 6 hours? How many of these analgesics can you give 4 to 6 hour frequency? So learn this as acetaminophen, aspirin, like this. Okay, let's say fluoribrufen, like this. And then there is 6 to 8 hours. Learn those as well. So you know what, these kind of permutations and combinations, like try to make these PNCs, permutations and combinations, and learn these things. The more you try this, the more you will learn this. Like, do not just cram it. Is like, let's ask yourself, okay, frequency QID, which all drugs do have this frequency? Frequency TID, which antibiotic have this thing? 6 to 8 are in analgesics. Okay, which analgesics are those? This strength is available. Let's say 250 to 500 if fluzinal is available. Is it 300? No. Which is 300 etorolac is available. Okay, so this is how you should memorize these things, by using the permutations and combinations. This is a similar table for analgesics, which, because that was a picture which I took, which table I made manually. So this is the sheet which I made it here on my computer so that you can have a better idea how, like, you can clearly see that what actually this table is about. So here we have listed all the drugs: daily maximum for adult, daily maximum for pedo, adult dosages, pedo dosages, frequency for both adults and pedo, and strength available in the market. So here we have listed all the drugs and we have filled all the information we know. So by looking at this table, you can see that aspirin is not given in kids, celecoxib is not given in kids, celecoxib is given once or BID, difluzinal frequencies every 12 hours. So this is how you will memorize this table. Okay, and similarly, this is analgesics as well. I have put this table just for you to jot it down on your on a piece of paper to have a look at it time and again. Antibiotics. Similarly, this is antibiotics, and we are the similar table which we have seen already. So this is talking about all the antibiotics which are really important. So what you have to do is you have to fill the frequency, memorize these, and fill these in the table. Get it photo stated, get it photocopied, and as many as you want. Let's say 10, 20, 30. You can photocopy these. In those photocopies, you can fill in the information after you memorize, or when you think you have memorized, fill in this in, like we have done it here. So I'm just gonna move past this slide because the only purpose of putting this slide over here is that how you have to fill in the information. This is just for you to cross check once you have filled the information, once you have memorized, and to check your answers. This is the opioids. You have to memorize, let's say oxycodone, acetaminophen, 10 mg is not available in Canada. Q4 to 6H, so exceptions are really important. Meperidine, the adult dose is 100 mg, but the strength is available only 50 mg. So this is really important. Similarly, anesthetics, why did I choose to put this thing here? You will find this table at many places, but the thing is that when you are making all these tables which has the numbers or the figures in 2 sheets of paper, these are very easy for you to carry with you. You can carry it anywhere, anytime. You have 15 minutes, you have 20 minutes, you can just take out the sheet and just memorize these. Similarly, antifungals. I have a slide next to this one in which I have filled all the information so you can copy it. So I have just stated that this is very as well. So similarly, these miscellaneous drugs are asked time and again as cyclobenzaprine, acyclovir. This was the slide I was talking about. Antifungals, nystatin, fluconamide, itraconazole, 4 lakh to 6 lakh. So I have the information here. You can fill it out. This is a blank table. This is the table which has been filled with all the information. So you can take a printout of the right table, the table on the right hand side, so that you can fill it with the information after you have memorized this thing. So basically you have to do this for all the tables. Okay. This will save you time and effort, but just make sure to check the first time. So this is the antibiotic prophylaxis table. So what you should do is get at least 20 to 30 pages photocopied and test yourself depending upon the time left for your exam. Let us say you have 3 months to go. Since you are studying for ACJ, take out the sheet, say once a week, and try to write the answers and then check those. Pay attention to your mistakes, revise again and again. So keep doing this once a week, twice a week, thrice a week, as per your convenience and according to your schedule.